Welcome back to Trade Talks. I'm your host, Leanne Alfaro, producer and host here at Nasdaq. Joining me today to talk about the drug addiction crisis, which is responsible for more than $700 billion in cost to the U.S. economy, is Dr. Indra C. Dambi, who is addiction expert as well as the medical director at Center for Network Therapy. Thank you so much for joining us.
Thank you.
So tell us a little bit about this immense cost to the U.S. economy of $740 billion due to use of illicit drugs and alcohol.
Yes, when you look at alcohol, the prescription drugs and the illicit drugs, the cost that we spend to treat these people who are suffering from addiction is over $600 billion. So out of which, if you also add like tobacco to that, it'll increase by 300 more. So that'll be a total of 900 billion.
Wow.
For treatment, for loss of productivity, and the criminal justice system, everything, all the expenses goes under that.
Now that's an immense cost. And how does it look like with drugs, for example, ketamine as an example?
Ketamine recently has been approved for depression, treatment of depression, but it's not cost effective in my opinion. The reason being that 28 milligrams of nasal spray is going to cost, the total treatment has to be 12 treatments a year, so it's going to cost approximately $10,000 or more, whereas you can buy 100 milligrams of ketamine on the street for $10. So that's the worry, because like there are 16 million people who are suffering from depression now, and out of which 5 million people are not getting treatment of any kind, and there are 3 million who are not benefiting from the treatment that they are taking. So now that's the concern. Now that they know that this is FDA approved, ketamine is helpful for depression, these people could turn to these street drugs. And the concern is the dose. They don't know how much they are consuming ketamine for this treatment, and also it could be laced with fentanyl and or heroin, and that could cost life for us again. So it's a huge concern.
A huge risk as well to
Absolutely.
Whoever the patient is. Now, listing these concerns, what is the healthcare industry doing to rein these costs in?
As of now, healthcare industry has remained status quo in treating people who are suffering from addiction as an inpatient rehab and detox, while the epidemic has been raging. So if you really look at the outpatient model, which I have been the frontier of putting an ambulatory detox in the state of New Jersey, more than 90% of people can be treated as an outpatient for addiction. So the detox from any substance can be done as an outpatient, and that cuts costs by 50%. For example, an inpatient treatment for a day is like $1,400. The outpatient detox for a day will cost half of that $1,400. So you're cutting cost and a greater efficacy, meaning the outcome is pretty high, and it's positive for people who are using drugs, and they could go back to their workforce immediately, and it's also like reducing the stigma. So I think looking at more of a cost-effective outpatient model will be something that the medical profession should be looking into.
Now, taking a look at the current state of affairs where we're at right now, what responsibility falls on the patient, and where does the responsibility begin to fall on the doctors?
That's so murky right now. People are saying to the patient that you should know what you're doing, as people are getting mixed messages. It's okay to take ketamine for depression because it's a real good medication for depression. Antidepressant has not been helpful, and so within 2 hours they get a relief from this nasal spray. If that would be monitored appropriately, and if somebody can really get 12 sittings of ketamine treatment in a year, that'll be a great model. But the problem is we need to learn from what we have done in the past. Opiate, say for example, for pain management. That's not been monitored well by medical professionals, and so this is why we are in this crisis now. So ketamine has already been used as a street drugs. So I really do have concerns about this.
Well, we look forward to keeping up with updates and hopefully the increasing education on both the doctor end and the patient end, as well as progress in making this more affordable for patients.
Absolutely right.
Dr. Indra Sidambi, thank you so much for joining us again. Nasdaq followers, please stay tuned for more coverage right here from Trade Talks. Again, that has been Dr. Indra Sidambi, who is addiction expert as well as medical director at the Center for Network Therapy. Stay tuned and see you soon.